Hey guys, it's Liz with Mangat Copit Plastic Surgery and Skincare here. I just wanted to talk a little bit about dermal fillers today. So dermal fillers, or HA, hyaluronic acid fillers, are basically just a gel that recreates structure and volume wherever we place. So really, as we age, we lose volume not only in our fat pads, but also in our bone. And really that contributes to overall facial aging and sagging. And so it's really important to restore and replenish that volume wherever we've lost it to keep things nice and up and lifted. So common places we'll use filler are in the cheeks to kind of help restore the structure that helps hold the rest of your face up. Lips are another very common area where people are familiar with filler. It's fun to get a little pop in your lips, of course, but it can also be used to help, address some of the signs of dehydration and lines in our lips as we age. Our lips age too, so it can be used for that. Chin and jawline is another really common place where we'll use filler just to help balance out your profile. And really, filler will last about a year, so it's a great treatment, depending on where it's used. You don't have to do it very often. And that's a little bit about dermal filler for you.